Malaria, a silent killer, destroying dreams and limiting many people. In a bid to eradicate malaria, the world commemorates Malaria Day to raise awareness about the mosquito-borne disease and examine efforts towards the prevention, elimination, and control of the disease. This year, 2023, the World Malaria Day theme is Time to Deliver Zero Malaria, Invest, Innovate, Implement. It is a call to implement the currently available tools and strategies to reach those who are in need at the Western Pacific. So, we spoke to experts who shared their expertise on causes, effects, and preventive measures ahead of the World Malaria Day. The world commemorates World Malaria Day to raise awareness about the mosquito-borne disease, as well as examine efforts towards control, prevention, and elimination of the disease. Join me as I examine citizens' opinion on malaria, its causes and effects ahead of World Malaria Day.
Malaria is an infection caused by a parasite, the Plasmodium. Commonly around us is the Plasmodium species. But there are many species, but in Africa, in Nigeria, the commonest species is Plasmodium falciparum.
Malaria is actually a sickness caused by a parasite, mosquito parasite mostly. If you've been bitten by a mosquito continuously, you'll definitely come down with malaria.
Primarily, it's caused by a vector. It's carried by mosquito, and then when you have mosquito bite, Plasmodium is introduced to you, and then the associated symptoms comes. So when we talk of malaria, is caused by a parasite called Plasmodium. And where can you find the Plasmodium? The Plasmodium could only be found or harbored by a female Anopheles mosquito.
Simply put, malaria is a disease that is associated with a vector transmission of the female Anopheles mosquito, and mostly comes down with some symptoms of fever, chills, shivering, headache, loss of appetite, and more.
People treat malaria in different ways. Some do self-medication, others go herbal, while some visit the hospital. The twist here is, with the level of treatment, malaria is still a major public health challenge in Nigeria, despite substantial efforts to reduce the prevalence and impact of the disease. Spectrum Television got diverse responses from citizens on why malaria lingers despite efforts put in place to eradicate it.
Going for tests, since this Nigeria, it's only when the disease starts that's when you go for tests. You can't just go for tests when you don't have when nothing's wrong with you.
Countless times I've had malaria, and I believe in medicals, hospital. I don't really believe in all these traditional works. I don't believe in them because they don't work for me. People have different ways of belief, but for me, I treated my own through using the prescribed malaria drug.
I normally have malaria. Normally, for malaria, it depends on people's immunity. That can determine how often someone will have malaria. But for me, I think I treat malaria once every 3 months. Sometimes because of environment and the mosquito around. Yeah.
We complain of the Anopheles mosquito being the primary cause of malaria. However, how well do we take care of our surroundings to prevent malaria?
For me, I take preventive measure, like my house. I use mosquito nets, and I also have insecticides, mosquito repellents. Yeah, that I use all the time. So I make sure it doesn't happen. But most of this time, these things it doesn't work all the time. I would say so.
I don't think I have any malaria in my life before because I do treat myself and I keep my environment very neat.
I do try my best to, keep my surrounding clean, avoid having stagnant water, which is actually what they breed on. Then fumigate.
I make sure my house is okay, like use the right insecticide and then Cover myself if I'm outside the house, maybe coming to night class to read. Then make sure I protect myself from mosquito bites.
If you live in a places where there are gutters and stagnant water, you try to clean them, clear your environment, bushes, mosquito breeds there, lays egg, and then the egg grow into larva and all of that. So you clear water, you clear your gutters.
For us, prevention plays more pivotal role than treatment. Where do you find these mosquitoes? You find them where there are white bushes. You find them where there are stagnant water. You find them where where do you even find stagnant water, like in gutters and other places around you? Then how else do you even prevent? Let's assume where you are living or where you are staying, you don't have control over the bushes around there. Even where they have stagnant water, what do you do? By introducing oil into that stagnant water, it will, because the plasmodium have stages. The larval stage of the plasmodium will not be able to survive it in the water that any kind of oil is being introduced. Assuming there's a stagnant water and you cannot pull the water out, you could introduce, so even if it's a condensed oil or any kind of oil you have, it will distort the metamorphic process of the plasmodium.
There are a lot of measures that can be put in place in the prevention of malaria. Most importantly is making sure we avoid stagnant water around our vicinity, in our environment. Another measure too is to take care of the refuge dumps, because you discover that wherever there is refuge, on the ground especially, there are going to be pockets of water around there, and those pockets of water will serve as stagnant water that will aid in the life cycle of breeding mosquitoes that will eventually become the vector for Plasmodium.
Statistics have shown that about 600,000 deaths in Nigeria every year is due to malaria.
I am in no for herbal treatment. No, I do not subscribe to herbal treatment. From my understanding, most herbal treatments for malaria are not scientifically proven. Yes, so I feel like most of them are just plenty mixtures that are not measured and all of that. So I feel it's very dangerous.
Treatment. I actually don't subscribe to herbal treatments, and my reasons are this. You see, when we claim that this was handed over from father to son, and it has been generations behind, I agree. But you also understand that in those times, those were the available medicines. Now, technology has come in. I tell people, why is it that when you want to go to Abuja, you don't start trekking or you start using your bicycle? That was the means of transportation then. But now we have planes that can land you in Abuja in 45 minutes to 1 hour. Secondly is that most of the people who sell these drugs, it's part of hustling to make money. And then, what is the dosage? Say 1 cup, is it a big cup or a small cup? And you find out that most of these things are very, very harmful to the kidneys, to the liver. So a simple problem becomes a big problem. So I discourage herbal medications. Now, there are now herbal medications that has gone through NAFDAC approval. They have done research on it, and they have seemed to be functional. In fact, the other day I saw a bitter leaf in capsule. Do you understand? And I think it had NAFDAC approval. I'm not so sure, but see, there are drugs that are being approved for use, and they are herbal medications, and they are fine. But the one that you just go, someone will tell you, drink, give you 1 gallon, and you drink. I don't subscribe to that. And the reason for self-medication, one, I think, is largely ignorance. We feel that we know when we do not know. Secondly, is the high cost of healthcare. I'm aware that Akwa Ibom state government is trying to, for health insurance. We already have the national health insurance. How many people are on it? Can the least of the least, the poor of the poor, are they part of it? So this makes you, when you look at going to stay in the hospital, then another thing is the long queues in hospitals. Like a state like ours, we have only 1 tertiary institution. So you expect that when you come, you see a large number. So those long queues, people want to cut those corners. And sometimes we also lack faith in our healthcare facilities. Those are the reasons someone will now go and take over-the-counter medication, self-medications?
There's nothing so much wrong with herbal treatment, but what happens is the dosing of those herbal treatment. Don't forget, there are some herbal treatment now that now has NAFDAC number. Like we have a herbal tea now that is used for anti-malaria. It's called Tramadol. NAFDAC have done some preliminary experiments on it, and they have approved it for use. Now those herbal products are standardized because you can tell the quantity to be used and how many times it could be used. But the herbal preparation I may not subscribe to are those ones that have not been subsidized. That is, the dosing are not uniform. Somebody could come and they say take 2 shots, another person come take 3 shots, and so there is no formula to it. Those ones could become injurious to the person, and then there are no experimental studies on them. It's something great grandfathers just handed over to them, and so they continue that way. But for the ones that they have done clinical trial on and find to be fit, then there's no problem on them.
Some died due to self-medication. However, residents of Uyo, the Akwa Ibom state capital, complained that not everyone is educated on the root causes of malaria and thus turn a blind eye to it. To salvage this situation, we spoke to a medical doctor on the symptoms of malaria. How does one know that he or she has malaria?
Malaria symptoms, we say everything malaria mimics every other thing. That's why people call everything malaria. So you are likely to have fever, and in that fever, it's more at night. So it's more at night. You can have chills, you feel cold, you can have rigors. You see people that have both cold and they are shivering. You have headache can be part of it, and can be vomiting. You know, what is peculiar about malaria too is that you have high fever, which is actually worse at night. Malaria fits, the symptoms of malaria most of the time are just symptoms that can mimic every other thing.
In children, symptoms is mostly fever, but you would notice this fever that comes at night and then goes during the daytime, and then they play and be like nothing is going on, but symptoms are mostly fever, and then they get weak most times. Sometimes they do not play as often as they're supposed to. So once you see that fever, mostly in the night, you should come to the hospital.
Common symptoms could involve fever, vomiting. Now, when people have malaria, all the symptoms may not present itself at the same time. 1 or 2 symptoms, fatigue. Some could feel nauseated. Yes, some can feel nauseated. They could have nausea. Some could have headache. Some could have abdominal pains. And so when we talk about symptoms, when people have a particular ailment or disease, all the symptoms may not play at the same time, but some could play. But those are the commonest symptoms of the malaria parasite.
Most of the symptoms of malaria have related symptoms to other disease, like fever, like headache, common symptoms of other diseases, like typhoid also have symptoms like fever and headache. And most of the symptoms of malaria can also be related to other diseases. But the most critical thing that should be done for you to differentiate which disease is actually causing the fever or the headache is to do a diagnostic test to ascertain what is the root cause of that symptom.
How does one know that he or she has malaria?
Okay, you first go for tests, and then you'll be given your results, positive or negative, depending, and then go to the pharmacy and get your tabs.
When you get to the hospital, you see your physician. The physician will have a detailed talk with you. History taking when interviewing a patient who comes in for consultation helps you know what direction to go to. Like I said, if someone comes with convulsion, it can be meningitis. If someone comes with headache, it can be cancer in the brain. But It's the discussions that will help detail this is it and this is not it. That's why people complain that we ask too many questions. So that will detail whatever it's going to be. But when you get to the hospital after your discussions with your healthcare provider or physician, they will now do a test. Usually it can be a blood film for malaria parasite, or it can be you have this rapid diagnostic test kits that can quickly just tell us if malaria is present or not. So with that, you then start your anti-malarial medication.
So far, Akwa Ibom State Primary Healthcare gave free mosquito nets in a bid to eradicate malaria. Do citizens sleep under insecticide-treated nets? How often do they use it?
I use mosquito nets and I don't wait till I fall ill.
I use mosquito nets anytime I want to sleep. I'm not really a fan of mosquito nets, so I just try to fumigate my house.
I don't sleep with mosquito net because I fleece my room. I make sure that there's no mosquito inside, and I also have a chemical in the house that I sprinkle the house. Before leaving the house, I'll shut all the door, then sprinkle the house with that chemical.
It is worthy to note that the NAFDAC, within the ambit of the World Health Organization, has recently approved for the R21 malaria vaccine to be used in Nigeria. Are citizens aware of this vaccine?
If it's government approved like it has been, then I just think we should try it out to see how effective it is. But I have no, like I said, I'm indifferent about it. If this is the government's doings, then it should favor us.
To get proper understanding of the R21 vaccine, we spoke to professionals.
It doesn't please us as pharmacists to see people, having malaria now and then. So anything that improves on the health of the citizenry is what we pharmacists stand for. The R21 vaccine is a very welcome development to we pharmacists because it's going to lessen the burden. If you look at the statistics of the number of persons that dies of malaria yearly, be it locally and internationally, then you have every reason to rejoice that at the end of the day there's light at the tunnel. People will not be saved. So the vaccine is a very welcome development.
Regardless, the last decade of malaria control has witnessed increased support by the government of Nigeria and its partners to scale up key interventions such as massive campaigns and replacement of insecticide-treated nets. However, all hands must be on deck to ensure a malaria-free nation. Residents of Uyo therefore gave an advice to the populace on malaria.
My opinion is that at least once someone starts to observe the symptoms, the person should rush to a healthcare facility so that will be taken care of.
Just advising people, best thing, use your insecticide treated mosquito nets to prevent malaria and everything will be fine. Then try to keep your surrounding clean. Avoid stagnant water and everything will be alright.
The first and approved way is to use the net. That's the best way, to use the net. Normally we are supposed to prevent water from our environment so that it will stop the breeding of malaria or to the breeding of mosquitoes. So if those things are being done and we still see this malaria, it will still come. So we need to get our mosquito nets, approved ones from the clinics, and then every 3 months you try your best to treat it. Don't really wait till you see the signs.
My advice is please look out for yourself. Malaria is dangerous. I know in this part of the world we don't see it as a very serious illness, but it's really a very dangerous illness, especially when it gets complicated. So look out for yourself, look out for your children, sleep under treated mosquito nets. It will help you.
The advice is let them try as much as they can to prevent malaria by making that bushes around them are well cleared. There are no stagnant waters, and then as much as they can, they could have mosquito net around their homes.
Concerning the World Malaria Day, we are advising the populace to visit their pharmacist whenever they feel they have symptoms of malaria. Their RODT test can be carried out, and if ascertained that they have malaria, they will be treated properly with the right medication. You know, the WHO standard for treatment says there must be an artemisinin combination therapy for malaria. There must be the presence of an artemisinin in the medication the person is taking. Even though that enlightenment has been going on from time to time, most times people don't still understand why the artemisinin base should be there. It's also measures to make sure that we prevent resistance in the treatment of malaria, because most of the issue we have with our malaria treatments as a result of resistance. So our advice is that they visit the pharmacist in their community for their treatment and other advisory measures that they should take in the treatment and also in prevention of malaria.
The malaria is yes, it's still one of the leading causes of death, and that means if we identify it early and treat it early, then these deaths can be prevented. Self-medication just makes things worse. It has increased our sensitivity. It has reduced the sensitivity of these anti-malarials. So we're having more anti-malarials not working. So you have to visit a practitioner, a healthcare practitioner, get your medications, complete your doses, and then live a disease-free life. Malaria may mix so many other illnesses. So it's not anytime you see you have fever, you have chills, it means it must be malaria. It can be any other thing.
The last decade of malaria control has witnessed the government as well as its partners take preventive measures to ensure that malaria is eliminated in Nigeria. Are these efforts enough? Well, all hands must be on deck to ensure that Nigeria is malaria free. My name is Blessed Dixon, reporting live for Spectrum Television. Enjoy the rest of our programs.